We are now talking with Dr. Richard Adler, who graduated from the School of Medicine, specializing in podiatry in 1977. And thanks for coming in.
It's my pleasure. Thank you.
Appreciate it. Let's talk a little bit about having done your undergrad. You came here for medical school to study podiatry. What was the inspiration? How did you get interested in that?
When I was in college, I was being treated for some sports injuries. Found out about podiatry and enrolled at the Pennsylvania College of Podiatric Medicine, which later became the Temple University School of Podiatric Medicine.
Got it. Got it.
There you go.
How challenging when you were here for that program was it? You hear so much about the difficulty of that level of study.
It was very difficult. It was very, very difficult. Very steep learning curve.
Yeah.
And after I finished school here, then went on to residency and practice.
For your career, since you've been in practice, what would you say is the most challenging part of your job, and has it changed at all since you've been in it?
The challenge of any medical career is growing your practice. We've been very successful in doing that. We have a very large practice, one of the largest podiatry practices in the country. The challenge is making that all work, both the business end and the medical end of it. And it's been a fun experience. We enjoy doing what we do, obviously, or we wouldn't do it. And then one of the additional perks was being able to teach students. After I finished growing my practice, so to speak, I got re-involved with the podiatry school and the Alumni Association. I was president of the Alumni Association for 3 years. During that time period, we raised over $100,000 for student scholarships.
Fantastic.
Yeah.
On the flip side, getting back to the work part, because I want to talk about the Temple part in a minute, what would you say is the most challenging part of what you do?
Passing the boards. Passing the boards was no fun. Did it on the first try.
Well, there you go.
There you go.
There you go.
Yeah.
For your practice, is one of the biggest challenge simply growing it? Because I think a lot of people don't look at a medical practice as a business, that you do have to grow.
You have to have some business savvy. You get out of school with a degree. You get out of your residency and you get board certified. But until you grow your practice, you have no business. And in the past 35 years, there's been tremendous changes in the economic climate of medical practice, and things we have to deal with now in terms of insurance issues didn't exist 35 years ago. It's a totally different playing field now. The insurances have totally flip-flopped. The burden of payment is really on the patient, and I don't have to tell you about the current political climate and the controversies brewing as to how we pay for our population's health care.
Right.
You know.
Right. I guess dialing back to the Temple experience, you came here for medical school, having done undergraduate study at Rutgers. How prepared did you feel when you finished your experience here at Temple to really build that practice and start this career?
You get out of medical school and you're very well educated. You don't know anything about business practice. That's one thing that you hit the ground and you have to learn. You come out of with a very good education in all matters medical. Okay, medical or surgical, but you don't know anything about practice. Okay, that you have to be mentored, and you learn from trial and error. You have to be a human being. You know, if you're a human being and treat people properly, they're going to appreciate it, and you'll see the rewards of that.
I guess continuing along with that, for the students who are going to be graduating in your discipline, what's your advice to them?
You have to make friends in the podiatric community and observe when you're a student. so that when you are completing your residency, you have some idea of the kind of practice situation you want to be in and how to run that. And we have quite a few students that do rotate through our practices to observe. Without that opportunity, students have no idea how to run a practice, and quite honestly, there's no time for them to learn that while they're in school.
Right. So for you to get into the classroom and reconnect with students that way, what's so rewarding about that for you?
It's fun. It's fun, you know. They come into our offices and they ask the right questions, and their eyes are open pretty wide, and when they see what's going on, and you can see things click for them. They've heard, they've been taught in theory, and then all of a sudden they can see the reality of what they're learning in the practice, and you know, it kind of re-energizes us. You know, what has become routine for us, all of a sudden we realize, hey, this student has never seen this, and now he understands why he's been taught that.
Great.
Yeah, so
all right.
That's very rewarding.
Couple quick questions for you. You knew early on sort of what you wanted to do. What profession would you never attempt?
Never attempt. I'll attempt anything.
Okay.
I'm very interested in other people's jobs.
Super. What is your favorite sound?
My favorite sound? I run a charter boat on the side, a fishing charter boat. When people hook up and they get all excited, that's my favorite sound.
That's a good sound to you.
That's a good
all right.
sound, yeah.
And a final question. How would you say that you are temple made?
How would I say I'm temple made? We were grandfathered into Temple after I graduated. And it's been a very interesting process where my institution has become part of a larger institution. And it's been a terrific learning experience in seeing how a bigger school functions. It's been nothing but wonderful in terms of working with other people in the Temple family. You know, it's been a real enjoyable experience.
Terrific. All right, we've been talking to Dr. Richard Adler, class of 1977, the School of Podiatric Medicine. Thanks again and congratulations.
Thank you very much.
Okay.